Good afternoon. I'm going to call to order this meeting of the regularly scheduled Public Health, Environment, Civil Rights, and Engagement Committee for Monday, August 20th, 2018. My name is Philippe Cunningham, and I am the chair of this committee. With me at the dais are Council Members Cano, Schrader, and Council Vice President Jenkins. Please let the record reflect that we have a quorum. On today's consent agenda, we have 4 items. The first is amending a council action to reflect an updated grant dollar amount and from Washburn Center for Washburn Center for Children grant for mental health services that are school-based clinics. The second is accepting a grant from the Minnesota Department of Human Services in the amount of $50,000 for a school-based clinician training for fall 2018. Number 3 is a site agreement, authorizing a site agreement with AmeriCorps to host for 1 year a Minnesota Opioid Response Corps member to work on designing and framing the work of the Minneapolis Health Department in collaboration with the Mayor's Task Force on the Opioid Epidemic. And the 4th item is authorizing the sustainability manager and the city attorney on behalf of the city to join in any state or national coalitions of government entities to defend the 2016 Clean Car Standards. With that, do any of my colleagues have any questions? I would also like to acknowledge that and welcome Council Member Johnson. Seeing no questions, I would like to move approval of the consent agenda. All those in favor, please signify by saying aye. Aye. Those opposed? That item is approved. So we have some very exciting presentations today. This is, while I really enjoy the business of the city, this is really an exciting part of the work that we do here with the committee, is being able to learn about what all the amazing city staff that we have here working, what the work actually looks like. A lot of times we talk about systems change and institutions as very abstract ideas, but it's actually human beings, as city staff know, that actually make the work happen in the city. And so as a policymaker, just to remind folks, I wanted to bring these presentations here, especially as we are going into budget season, so that folks, my colleagues in particular, understand all of the work that's happening at the city so we can make as informed decisions as possible when it comes to investments in this work. And I really enjoy being able to create space for folks to show their passion, because one of the coolest things about working at the city is that city staffers are so passionate about the work that you all do. So on that note, our first discussion item for today is the Healthy Sexuality and Healthy and Safe Children and Youth presentation. I'm very excited about this, a lot of work that I've done previously before being elected. So I would like to welcome Coral Gardner, Director of the Adolescent Health and Youth Development for the Health Department, and she'll be giving today's presentation. Ms. Gardner, the floor is all yours.
Okay. Good afternoon, Committee Chair Cunningham and other members of the committee. My name is Coral Garner, and I am the Division Director for Adolescent Health with the Minneapolis Health Department. Our division manages various projects and initiatives focused on the physical, mental, and social well-being of Minneapolis youth and young adults. Next slide. Our vision is a unified city where all youth and young adults are healthy, safe, and thriving. We have a team of committed individuals from diverse backgrounds with expertise in adolescent health, public health, youth development, mental health, juvenile justice, and violence prevention. Today's presentation is about our sexual health promotion work. Sexual health promotion is one of our key bodies of work focused on healthy youth development, and encompasses the health department's efforts to address sexually transmitted infections and teen pregnancy prevention. Our strategies fall into 3 categories: access to services with specific outreach to uninsured and underinsured youth, and safety net services through our community health clinics, promoting the use of science-based health education through our partnerships with Hennepin County's Better Together Hennepin, and our work with Minneapolis Public Schools, as well as funding to agencies to develop culturally specific education, and through public awareness with our partnerships with local advocacy groups to raise awareness, especially in communities with the highest disparities, about the importance of good sexual health, protection, and regular testing. Our health promotion is more than STIs, teen pregnancy, or early childbearing. To fully support young people's health, we need to address their physical, social, emotional, and cognitive development and give them the skills and supports to successfully navigate their teen years. The results of STI reports in 2017 show that teens and adolescents are most vulnerable age group to chlamydia and gonorrhea. In 2017, about 21% of all chlamydia reports were found among persons aged 15 to 19 in Minneapolis, while they make up roughly 7% of the total population. The blue boxes show the proportion of persons aged 15 to 17 and 18 to 19 among all residents in Minneapolis. In other words, 3% of the population were 15 to 17 years old, and 4% of the population were 18 to 19 years old. By the same token, the green bars show the proportion of persons in those age groups who were diagnosed with chlamydia. That's to say 9% of all the chlamydia reports were found among teens aged 15 to 17, and 12% of them were found among teens aged 18 to 19 years old. If all age groups were equally vulnerable to chlamydia, one would expect that the blue and the green boxes to share the same length, more or less. And a similar pattern exists for gonorrhea rates. The number of births to teen mothers in Minneapolis continues to decrease. From 2000 to 2016, the annual number of births to teen mothers aged 15 to 19 years decreased from 820 births to 228 births, or a decline of 72%. Decreases are evident among both the 15 to 17 and 18 to 19 age subgroups. Despite these trends, however, there's still prevention work to be done, especially towards achieving health equity. In 2016, the birth rates among teen mothers in Minneapolis was approximately 18 births per 1,000 females aged 15 to 19. However, it was higher in populations of color. Barriers to healthcare access, negative stigma, discrimination, and neighborhood conditions such as segregation and poverty all contribute to the disparities in STIs and teen pregnancies among youth of color. The Minneapolis Health Department currently has the following investments and partnerships in place to address these disparities: our school-based clinic work, our Youth Men of Color initiative, the culturally specific sexual health, our school partnerships, and our public awareness campaign. I'd like to turn it over now to Barb Cowell, who's our manager for school-based clinics, and she'll talk about our program in Minneapolis Public High Schools.
Good afternoon. I'm Barbara Kyle with the School-Based Clinics, as Coral said. Thank you for inviting me. I just want to point out we are school-based clinics located in 6 of the Minneapolis Public High Schools. We provide adolescent-friendly cost at no cost to the family or the students. We're very accessible. We can provide confidential care. We provide health education, physical health services, mental health services, sexual health services, and nutrition. There's kind of 2 main approaches that we do around sexual health. One is more of a clinical approach to addressing STIs. We have done a lot of STI testing. I'll show you in a moment some of our numbers, and counseling. We do those individual in our clinic, one-to-one visits with clients. It's scheduled or walk-in. We also do something called fast testing events that has been very successful in reaching more students. We also have a program that's called the Safer Sex Initiative that's funded by both a state grant and a local county federal grant, and it's a program for females that are adolescent aged, and they meet one-to-one using an evidence-based strategy, using motivational interviewing and counseling, allowing them to be in a safe place to ask their questions. And then another more clinical approach we have is we really do expedited partner treatment, and we really follow the CDC guidelines for treatment and testing. So some of the non-clinical approaches that we have, we do a lot of outreach. We probably reach over 10,000 young participants a year. We do classroom presentations quite frequently. We do lunchroom tables. We do social media. We play lots of games, and you can see a little bit. We play a lot of Jeopardy or fact or fiction and really get people engaged. In this last year, we've done health fairs at each of our high schools involving students to help facilitate those. And it's more than just sexual health, but really getting them connected to resources and questions and information that they need. We also have a youth council that has members of all of our high schools that we meet 2 times a month, and those council members do a lot of outreach. They do a lot of peer education. They help us with a lot of our tabling and social media events as well. So I just have 2 slides of data, and I'm not going to read the numbers, but I just wanted to show you over the years we've put a lot of effort into reaching more clients and doing more tests. And so the green line on the top is the number of just chlamydia and gonorrhea. We also do other testing, so that continues to increase. And the number of clients that we've reached each year also has increased. As I mentioned earlier, we do these fast-track walk-in clinic days, and we started that based on some work that was done in Philadelphia. And so the top line, or the bottom line that's blue, shows that we reach about 500 young people who we have a day that kids can come in, no questions asked. Then they come back for results and get more health education and also connection to other resources in the clinic. And then the top is where the number of tests we do during regular one-to-one visits. So we have a couple strategies for doing testing. And we've done surveys, and even though we think we do walk-in all the time, the students really do like these walk-in events. We reach different students. We have a high % of new people, more males, and also more LGBTQ students that come to our walk-in days than the regular clinic days. And then it's a chance for them to know we exist and come back if they have other health concerns. So I'm going to give it back to Coral to continue on.
So this is one of our programs that was funded with our Center from Disease Control grant, Coaching Boys into Men. It's a violence prevention program for athletic coaches. It's designed to inspire them to teach their young male athletes about the importance of respect for themselves, others, and particularly women and girls. We began implementing this program this past school year in 2017. And so far, we've trained over 30 coaches and outreach workers. That includes staff from North and Henry High Schools, and also Run and Shoot, which is a community-based program at Farwell Park. 110 athletes to date have participated in the program, and of the youth that participated in the fall program, with the results from the pre and post surveys, there was a significant increase in understanding and recognizing abusive behaviors. In this picture, that's Coach Adams from North High School, and I think it was during the Super Bowl week, the Minneapolis Public Radio did a piece on him, and I just want to share a quote from one of our student participants. Coaching Boys into Men teaches you stuff week by week. It helps give me goals. Our coach talked to us about how you should show respect and treat girls. Actually, I had a recent situation at school. I accidentally bumped into this girl, and she thought I did it on purpose and started screaming and yelling at me. But I was able to not let it get to me. I stayed calm and explained it was an accident, and I apologized. POSH is our program. It's called Positive Outcomes for Sexual Health. It's a health education and peer outreach program to straight, gay, lesbian, or transgender youth and young adults who identify as male. And we contract with Pillsbury United to implement this program. They provide culturally relevant chlamydia and gonorrhea prevention and intervention information and messaging on condom use to the target population. And they also provide referrals for testing and affordable or free care. And in 2017, POSH had 2,192 contacts through face-to-face contacts. They participated in 1,143 contacts with education, had about 1,000 contacts through social media, and they referred over 600 clients to STI testing. Neighborhood Health Source is another contractor that we partner with to implement the Seen on the Street program. They provide chlamydia and gonorrhea screening with a focus on young men of color. It's based in out of Fremont Clinic in North Minneapolis, but they do outreach in North, Northeast, and South Minneapolis. They have outreachers on staff that educate and engage young, high-risk young men of color impacted by the high disparities of STIs through prevention, testing, prevention, and safe practices. In addition to their street outreach, they also provide education in 3 charter schools in Minneapolis. They do work at the American Indian OIC, and they also have a barbershop program at All-in-One Barbershop where they do outreach and testing there. This contract was made possible through the funding that we got this past year from the city through our general fund, and so it's only been in effect since April. And year to date, they've tested 342 individuals and have reached 145 youth in 3 charter schools. Our Youth Power program is a partnership with Wilder School and Planned Parenthood. They provide health education programming to African immigrant youth at Wellstone International High School. And the program was designed by the youth themselves to be more culturally appropriate. In 2017, they trained 27 youth, and those youth were able to make 1,911 peer contacts, and they shared information on various topics such as sexually transmitted infections, sexuality, anatomy, consent, female genital cutting, cultural values, and traditions. We also provide technical assistance to Minneapolis public schools in their middle school program to ensure that they teach medically accurate, age-appropriate instruction on sexual health education to youth between the ages of 11 and 13 years old. And this past year, services were provided in 20 middle school locations. There were 2,269 students that received education on making proud choices, and there were 49 interactions with teachers, and we also trained, I think, about 6 or 7 teachers this past school year. Our public awareness work is done in partnership with a group called CRUSH. It's Community Restoring Urban Youth Sexual Health, which is a collaborative of professionals, youth, and community members who are concerned about the rising rates of chlamydia and STIs among teens and young adults. The city serves as the backbone organization for this group. It was established in 2013, and we collaborate on a variety of projects throughout the year. The most notable one is our annual STI Testing Day that is done every April around the time that the State Health Department releases their sexual health report. And the purpose of the STI Testing Day is to promote awareness about Minnesota's chlamydia epidemic, to stress the importance of getting tested if sexually active, and to promote where to go for no-cost or low-cost STI treatment during that date. This past April, we had 56 clinics statewide to participate and tribal organizations. There were 741 teens and young adults tested on that date. And of the 741 people tested, there were 5 people identified positive with chlamydia, 5 with gonorrhea, and 3 cases of trichomonas, and 1 case of HIV. And again, those people were referred for treatment. This is an example of some of our social media work, and this was done during the Super Bowl week. We partnered with Hennepin County Red Door Clinic and developed a Super Bowl-themed public awareness campaign. We also distributed safe sex kits to community outreach workers, such as the outreach workers connected with the Youth Coordinating Board and POSH to distribute information in bars and other public venues throughout the week. And the second is another one on the second page. Okay. So looking to the future, again, our priority for this year is timely HIV and AIDS surveillance and interventions. As you know, the City Council passed a resolution for Minneapolis to become a HIV fast-track city in March of this year. And so we're currently in a process of collaborating with community-based organizations and advocacy groups in the state and the county to determine what we need to do to develop strategies to end AIDS as a public health threat by 2030. We want to continue to improve and expand our STI outreach, focus on young men of color, promoting teen-friendly clinics, and advocating for minor consent. We will continue to conduct youth-led participatory research. Again, this year, I think our particular focus is going to be on Latinx youth because of the increase in teen pregnancy rates in that population. We're going to maintain health education and adolescent health efforts in the schools, continue to advocate for state-level health education standards that require science-based sex education instruction in the schools, continue to refine our social media presence, promote culturally specific approaches, and support and promote universal testing, such as our annual testing days. And that concludes my presentation.
Great, thank you. All right, I see that Council Vice President Jenkins is in queue. Go ahead.
Thank you, Chair Cunningham and Ms. Garner and your other colleague for that great report. It sounds like you guys are doing some really amazing work in helping young people understand the risk of that comes along with being sexually active, as well as understanding the various challenges to sexual health that are out there. I'm curious, you talked about the Youth Power program, and it looks like it's sort of specifically targeting Muslim youth and young people. And I'm just wondering, with your increased emphasis on culturally specific communities, will there be an expansion of outreach to East African communities that are historically have been impacted by HIV and AIDS as well? Is that a part of the priorities, or can that be included in the priorities?
Oh, if we had the money, it would definitely be included in the priorities. And again, our strategies, we adjust our strategies based on the data
Research,
and the research and where it tells us to go. We've had this partnership now with Planned Parenthood at the which is focused on East African youth that come through that program. And that's the extent of our work right now. But again, as I mentioned, we try to refine our work every year and adjust it.
Okay. No, I know there's a number of East African organizations, specifically women-centric organizations, that are really beginning to think about how to improve sexual health in East African communities, given the sort of physical and emotional challenges that come with FGM, or female genital mutilation. And so how do we help those communities to heal emotionally and as well as develop better sexual health practices?
Sexual health. Council Chair Cunningham, Councilmember Jenkins, we actually partnered, and now I'm blanking on the name of her organization. It's based out of Sabathani.
Hmm.
Ishroom.
Mm-hmm.
That's where we did our initial research was
Okay.
with that organization.
Sure.
And that was about 2 years ago. And again, the issue there was really to make sure that in programming that was developed, that there was more emphasis on anatomy and self-identity, because a lot of that people don't get in their home
Right.
country.
Mm-hmm.
And we continue to collaborate with Ishroom. It's
Okay.
just right now we aren't contracting with them.
Okay. All righty. Thank you.
Great, thank you.
Anything else?
Well, I was going to I had a couple questions. When you asked that question, I thought of East Maroon as well, so I'm glad to know that you all are already working together. I wanted to ask about cultural competency. We had some LGBT aspects of that. I'm just wondering, is that built into the school curriculum? Like when we talk about evidence-based curriculums, what is included in that? Like, and when we talk about cultural competency, does that include queer and transgender bodies and sexuality?
What we provide in terms of training, we partner with the University of Minnesota Prevention Research Center, and we contract with them to help us to provide training to schools that reach out to us for training. And so the basic training is on making proud choices, and then we also provide training on foundations, which is a kind of a supplementary curricula that really looks at, that's more inclusive. And yes, that's something that's on our radar, and that's something that we are constantly working not only with Minneapolis Public Schools, but also with our partner agencies to make sure that they are responsive as well. Because that was one of the key things that came out of our youth research that was done in 2015, that youth were underwhelmed with the type of sex education that they were receiving, that it wasn't necessarily responsive because it's typically either heterosexual or it leans towards LGBTQ youth as opposed to being more inclusive, because gender identity and sexuality are totally different, and in keeping that in mind. Yeah.
A lot of folks don't understand that, so that you're a woman after my heart. Well, thank you so much for that. This might be for one last question. This might be for Barb, but I'm curious. I've really been taken aback by the numbers and the ratio of homicide to suicide. I just learned today in Hennepin County that it's like 4% of the cases that the medical examiner gets are homicides, whereas 12% are suicides. So it's significantly more. I'm curious, what are we seeing this reflected in the school-based clinics? Like, is there greater support that's needed? What kind of suicide prevention support is there or can be provided?
I think there's always, Council Chair Cunningham, that's a great question. I don't know if I have the whole answer, and I'm not really super familiar with what you're quoting. I know that we partner very closely in the school-based clinics with different members in the school. We're part of the local Children's Mental Health Collaborative, and so made up of different agencies that focus on children's mental health. We do a lot of training with our staff. Our staff has done a lot of PD or professional development with teachers around suicide. When there is a suicide in the schools, if it's a client of ours or not, we've provided a lot of support and debriefing. I think it's something that we've talked about a lot, and we've worked with very actively with school people, because it is something that every year we see, and it really impacts all of the students and just the subsequent. So I think it is a really important area that we have to continue to grow on and keep doing work, but we have some great players in the school-based clinics that are very active in prevention.
Thank you so much.
Thank you.
All right, Councilmember Johnson.
Thank you, Mr. Chair. Just a quick comment. I want to thank everyone for their work on this. I was really impressed by the presentation and the outcomes.
All right, seeing no further questions, I move to receive and file this presentation of healthy sexuality and healthy and safe children and youth presentation. All those in favor, please say aye.
Aye.
Those opposed say no. The ayes have it, and that item is received and filed. Thank you so much for that very thorough presentation, and thank you for all the work that you do. Our next discussion item is here. Let me see. Is the environmental education presentation. We are going to be receiving and filing a presentation on the Minneapolis Environmental Education Initiative in the advancement of STEM education, specifically environmental studies, with the support of community members, agencies, and businesses. Today we have Marquita Keys, who is a health inspector in our environmental services, and she will be giving the presentation today. Ms. Keys, the floor is all yours.
Good afternoon, Chair Cunningham and council members. My name is Marquita Keys. I am employed in the Health Department, the Division of Environmental Programming. When I am not conducting pollution inspection responses and routine inspections, I also manage an education program. And so I'll be presenting on what we've done thus far. So the Minneapolis Environmental Education Program aim is to provide resources to instructors, teachers, and/or institutions in the implementation of strategies to advance environmental education through experiential learning opportunities. And so really quickly, I just wanted to talk about why we think that environmental education is important. First of all, we believe that environmental education is a part of STEM education, so science, technology, engineering, and math. We know that STEM occupations are on the rise in the United States. They are growing greater than any other occupations. We know that STEM workers play a vital role in the stability of the economy in the United States. And we know that our students, locally and nationally, are lagging in their preparation for STEM work. So we would like to expose students to STEM to help them develop a passion for this career work. So here's what we are focusing on. We want our students to be engaged in methods to be exposed to environmental education. We believe that providing our expert colleagues in the classroom to expose our students to the work that we do is extremely impactful. We believe that getting our students in the field, into facilities both here in the city and otherwise, are impactful for their education. We believe that by providing teachers and schools with resources for research to engage our students and educate them in STEM work is impactful. And we also know that engaging community members, businesses, other schools, charters, small businesses, large and small, are impactful for partnerships. We also know, we believe that all these factors will help our students to be informed and get them engaged in STEM, most especially environmental education. And I wanted to focus on, we really started this path trying to engage schools that are underserved, so in communities where they would not otherwise have access. So I wanted to make sure I included that in order to increase pathways for diverse populations, both here and otherwise. So far, we have provided funding for environmental camps, funding for tools in the classroom, as mentioned prior. We have provided funding for tools in the classroom and outside the classroom for research for students. We have developed partnerships with Minneapolis Public Schools, with local organization Project Sweetie Pie, with Just Be Solar, a small minority-owned business, with Hennepin County, the University of Minnesota, the Minneapolis Park and Rec, and also the City of St. Paul. We believe that our most cherished asset is our colleagues here at the city, the folks who are doing the work every day. So just to give some background into what we've done thus far, in 2014, the Minneapolis Environmental Education Program worked at Anderson United Community School. We were able to fund 10 students, highly mobile students, to attend an environmental education camp up in Finland, Minnesota. Once those students were there, they were able to use our tools that we use every day for research. So they took our Suma canisters, you can see on the left, and they conducted air research, air quality research. They also were able to receive, through us, some funding for hot water quality testing kits. And so they also did water quality testing in Finland, Minnesota. When they returned home to Minneapolis, they were able to do their own research in their own community and learn about how the environment they live in impacts their everyday health. Also at Anderson United Community in 2014, 2015, we were able to send 4 of their teachers, general ed teachers, to the University of Virginia to learn about how to be expert scientist teachers. Since their focus is general ed and most of them ESL in this community, it was really beneficial for them to learn about how to get their students engaged in environmental work and in STEM work specifically. And they had a few key takeaways. They learned that their students should really be using organisms, real-life organisms, to do their research. They learned that field experience is very important for their students. They learned that real research is important and impactful. And they also learned to teach their students to think like scientists every day. And once more, students learn best by hands-on experiential learning. In 2016, we were able to work out at North High School. Up on the right, you can see one of my colleagues. She is teaching the students at North High School in an ecology class about the importance of pollinator habitat, about recognizing pollinator habitat, about native bee identification, and then she took those same students out into their own community to plant pollinator habitat. It was really cool. 2016 as well, the students were engaged in Earth Day activities at North High School. So we partnered with Hennepin County Forestry. They were able to come into the classroom and teach the students about trees, tree identification, and then they built a gravel tree bed alongside the students. So they built this bed on the courthouse at North High, the courtyard at North High, and then in the spring, they transplanted those trees in their community. They were also able to conduct a tree tour and have an Earth Day fair in their lunchroom. Moving forward, in 2018, this summer, we partnered once more with Minneapolis Public Schools. We partnered with their Guys and Gems program. Guys and Gems is a STEM program that operates after school and during the summer. Guys is guys in science and engineering. Gems is girls in engineering, math, and science, so they're gender-separated courses. Students are allowed to choose out of a wide variety of courses a class they would like to focus on and study, and they work on it through the summer and then after school as well. So these students are grade K through rising 8th. They are there through the summer, June 18th through August 2nd, Monday through Thursday. This summer, we partnered with Guys and Gems to offer a solar camp. So we contracted with Just Be Solar, a small minority-owned environmental solar camp educating organization. And they were in the classroom a couple of weeks and they taught the students the very basics of solar and circuitry. And I have photos. On the left side, you can see young ladies working on building their solar houses and then working also on the circuitry. We also worked with another camp termed Expedition Minneapolis. This camp is very specific to getting students into the field to explore nature, learn about the environment. So a piece of that camp was tree identification. So we have our scholars working with my colleagues from the city of Minneapolis and the classroom. And this particular picture is an urban scholar on the right teaching students. On the left is one of our seasonal technician interns. They're teaching students with a dichotomous tree how to recognize trees in their community. This particular camp, once more Expedition Minneapolis, also conducted soil and soil lead lessons. So students were able to learn from my colleagues once more about soil, quality, soil structure, and then lead in the soil and how it impacts their environment. And then they were able to go out into the field and collect lead and use the machinery we use here every day to test the soil. So both these pictures show one my colleague and the other is a teacher in the classroom. Once more, I'll note the importance of field activities and field experiences. So on the right, these are students who have learned. They had their classroom lesson on how to learn and see and recognize trees, and now they're in the field identifying trees. I will say, for that particular lesson, we did focus on the emerald ash borer and the ash trees. On the left side are students at the water treatment facility. This is a field experience that we agreed to fund transportation to. The folks at the water treatment facility were really good about hosting 150 students and getting them around that site, and they were really excited about being there. So looking forward, I just wanted to note the benefits of the work we've done with MEE. We are supporting small minority-owned businesses. We are inciting interest in science for our students, scholars. We are exposing everyone to nature, which is good for everybody. We are aiding educators in the classroom. We are offering purposeful work experiences for colleagues here at the city, and we are preparing our most talented students for a future in STEM. There is opportunity, and that's to continue to expand the work we're doing now, but we feel like we can expand these intersections through STEM enterprise-wide. And we feel like we could get folks from the water treatment facility in the classroom and then have that field experience connected there. We also want to continue to bridge partnerships with Minneapolis Public Schools, with Just Be Solar, and then I forgot to mention Mind Foundry was a 2017 council-funded action one time for a Mind Foundry education for students in the East African community. And those folks are here today to maybe talk shortly on their experience over the summer. Thank you.
Great, thank you so much. Did you want folks to come up to tell the story? You came all the way here. Get up here. Let's hear from you. You want to share some of say your name and share your experience? That'd be wonderful.
Yes, thank you, Chairman Cunningham and council members. My name is Mahad Ibrahim, and we were happy to partner with the health department this summer to do 6 weeks of camps covering anything from aerodynamics, flight, deep sea exploration using remotely operated vehicles, robotics, a whole suite of things. We try to weave in not just sort of STEM lessons, but weave in also real practical experience, telling stories, doing narratives, explaining what the outcomes of the camps are. We particularly are really important to get people in the classroom who look like the students and relate to the students, and so they can see in themselves a future. Many of them students from University of Minnesota, other sort of local colleges and campuses, and to kind of weave in some culturally appropriate lessons into the sort of the lessons and things of that nature. So I know there's not too much time, but yeah.
No rush. Yeah, thank you. Do any of my colleagues have any questions? Well, I do want to, so this is a part, you developed this during the space that you all get, right, as a part of working in the Environmental Services Division.
Mm-hmm.
So I just wanted to point that out to my colleagues for two reasons. One, that Marquita is the lead on this as an inspector, and I think that's amazing. And also quite the significant benefits there are from our city staff being given space to be passionate and do the work that you all love to do. It's clear that you're really excited about this, that you're making some connections and figuring out how to put it all together. So I just wanted to say thank you for all of your hard work with putting all of this together. Councilmember Johnson.
Thank you, Chair Cunningham. I also really appreciate the presentation. I particularly like seeing the immersive experiences in the woods for students. I read this great book on this topic about nature deficit disorder, Last Child in the Woods, and just how impactful these experiences can be for children, especially in these modern urban environments, to be able to get out there and form that connection and at the same time learn, right? And so I just encourage more of those immersive experiences if there's ways to find those and incorporate in the lessons with the natural settings. Thanks.
Great, thank you so much. So with that, I move to receive and file the environmental education presentation. All those in favor of the motion, please signify by saying aye. Aye. Those opposed say no. The ayes have it, and that item is received and filed. Seeing no further business before this committee, we are adjourned. Thank you so much, everybody.